And lastly, the healthcare issue. My committee also has jurisdiction over all of healthcare policy. And as many of you know, I've been a leader, in particular on the issue of kids' health care for my 10 years in Congress. We have 47 million people in this country still without health insurance. 9 million of them are children. And I talk to my colleagues and friends from other countries. They can't believe that the country that fashions itself the leader in the world has 9 million kids who, when they get sick, don't have health insurance so they can go to the doctor. This year, this Children's Health Insurance Program, which I was active in improving the first time it came through, is coming back through Congress for reauthorization. And that's the other little chore Mr. Dingell has asked me to undertake. It's going to be easier because I agree with all the Democrats on the committee on this one, that we need to expand the S-CHIP program so that it covers the 6 million of those 9 million kids who are eligible for it. What it is, the S-CHIP program is a program that provides health insurance to people just above Medicaid eligibility. So it really is the children of the working poor. And for those of you like me who are parents in this group, you know that not only is it the humane and right thing to do, but it's also much more cost effective in the long run to take a kid for a well child checkup than to have to take them to the emergency room when he's already got a terrible ear infection or something like that. So that's going to be our main focus on healthcare in the short term. But on a more broad level, let me tell you that with 47 million people in our country who are uninsured and growing every year, it's really clear to me, and it should be to you, that we need some kind of national health care reform. And having been now in elected office 14 years, I always see what happens is Dottie Blom, some of you might have remembered former State Senator Dottie Blom. She was the head of the Huey Committee at the state legislature. She said, I always feel like a referee with a striped shirt when I'm dealing with health care because I'm always mediating between all of the healthcare groups. And that's the way it's been in Congress, too, is you have these supplicants coming into you asking for higher reimbursements for different doctors or different groups of classifications. And so Congress spends all of its time trying to figure out how to make the current system equitable without thinking in a bold way about the future. How do we insure everybody in this country? And how do we do it more cost effectively? And so I'm working on two issues. I've asked my intrepid healthcare staffer, Jed Perry, who just finished doing stem cell, but I've asked him to work with a number of the outside consortia who are working on overall healthcare reform issues. And frankly, I don't think we should take anything off the table. So I think everything from a single payer system all the way to a employer-based universal insurance program need to be looked at to see how can we insure everybody the most cost effectively that we can, and how can we do it in a way that's best for the American public and the consumer, which is really where our emphasis should be. We're starting to embark on that, and we're going to, I think as the vice chairman of the committee, I'm really going to be taking a leadership role in looking at national health care reform. So stay tuned for that in the next year or two. The second thing I'm looking at, and this is an idea that I have, so it's going to take, it's like stem cell. If you have an idea and none of the vested interest in Washington have had that idea, it always takes you a lot longer to pass it because you don't have anyone to help you. And so the idea I had is the way we score healthcare financing in Congress is by how much it costs to provide it, rather than scoring it for how it prevents problems. And so I'll give you the most pathetic example, although the most pathetic of many examples since I've been in Congress. When we did the Medicare prescription drug bill, I tried to do an amendment that would give Medicare coverage for seniors to have smoking cessation programs like the patch or whatever. And the chairman of the committee told me that he could not include that in the bill because it was too expensive. And I said, well, okay, so you think it's better for us to pay for the emphysema treatment and the lung cancer and heart disease treatment down the road because we don't have the upfront money to pay for the patch. That's the way we score. The Congressional Budget Office scores health care, and as a result, I fight this all the time. I'm the co-chair of the Diabetes Caucus in Congress, and right now, the CMS, the Healthcare Financing Office, won't pay for seniors to have a certain number, more than a certain number of blood testing strips a day, which is insane, because of course everybody knows diabetics who have their blood sugars under control face much less serious consequences down the road. So I'm developing a way to have budgeting of healthcare called a prevention dividend. And what that would mean is if we could prove that prevention, like child checkups or test strips or smoking cessation or whatever it may be, could prevent more expensive and terrible consequences down the road, then we would put our efforts and money into those prevention programs. So that's the other issue in healthcare that I'm working on, and like I said, it'd probably take me a little while to do it. I think that's in general what's going on, and I think it'd be a good time to answer some questions. Thank you.